Hello everyone, welcome to our YouTube channel Logic Medico. If you are new to our channel, kindly consider subscribing to our channel and don't forget to press the bell button. Today's interesting topic is Triceps Brachii. So what is this Triceps Brachii? As the name suggests, it is a muscle present in the arm. Brachii means arm. Triceps means it has got three heads. So this is a muscle present in the posterior side of the arm. It's a muscle belonging to posterior compartment. It has got three heads. Okay, so that is the understanding of triceps brachii. Let us see one by one. With the help of neat diagram, we can see. We just have to write a scapular diagram. Okay, that's good enough. We just have to write humerus diagram. We just have to write the olecranon process of ulna. So that much is enough. Okay. So here there is one groove. It's called the spiral groove. The spiral groove will have two lips: the lateral lip and the medial lip. So that is a spiral groove. This is the infraglenoid tubercle of scapula. So this is scapula. Infraglenoid tubercle. Obviously this is the humerus. And this is the ulna. So after knowing these parts, we are ready to write the origin and insertion of this muscle called as triceps brachii. So let's see the origin and insertion of this muscle. So origin of this muscle from the infraglenoid tubercle of the scapula, that's called the long head of the triceps brachii. From the lateral lip of the spiral groove of the humerus. So from the lateral lip it will be lateral head. From the medial lip and a triangular surface, posterior surface of humerus will be medial head. Initially the long head joins with the lateral head and forms a flattened fleshy tendon which will then join the medial head of the triceps. So all these heads now they converge to form a tendon. Now this tendon is inserted into the olecranon process of ulna. Now it is on which surface, which aspect? Obviously this is the posterior view, so it will be the posterior part of the superior surface of olecranon process of ulna. That is the insertion. I repeat, the posterior part of the superior surface of olecranon process of ulna. Coming to the nerve supply, it is supplied by one nerve called as radial nerve. Above the spiral groove, the long head and the lateral head will get supplied. In the spiral groove, again the lateral head and the medial head will get the nerve supply. So the nerve supply is by the radial nerve. Radial nerve. Action of this muscle, it crosses behind the joint. The joint name is elbow joint. So if this muscle contracts, what can happen to the elbow? So just think, this is your shoulder, this is your arm, and this is your forearm, and this is your hand. Just think that this muscle which is behind, it is behind, so it's behind your elbow. So when it contracts, muscle length will get shortened, right? So when it contracts, muscle length will get shortened and this will come behind. So that is called extension or the straightening movement of the joint. So here extension of which joint? Extension of elbow joint. That is the action of triceps brachii. Come to the clinical importance. Damage to this radial nerve can cause paralysis of this muscle, but if the damage is there in the arm, then this muscle is spared because the nerve supply for this muscle arises from above the axilla. It will arise the nerve supply to the long head and the lateral head, so it will be spared. So the extension of the elbow joint action will be intact despite the radial nerve being damaged. To check the triceps muscle, all that we have to do is ask the patient to keep his elbow in an angle and then ask him to straighten it, and then we have to offer resistance. That resistance should be overcome by this muscle. If the muscle and the nerve supply for that radial nerve is intact, this action will be performed. Thank you for watching and learning from Logic Medico. Consider subscribing to our channel and don't forget to press the thumbs up button showing that you like the video. Okay, share this video with your other friends. Thank you once again.